your operation, it makes the job for the anesthesiologist more difficult because your airways will be very irritated and they'll have trouble getting the breathing tube in and getting it out again. And you may end up with pneumonia after your operation, which again can be life-threatening. Other important things are leave valuables at home, including jewelry. Take off your wedding ring if possible. A lot of operations, we use electric current to sear blood vessels, and the metal on your ring can conduct and burn your hand. If you can't get your wedding ring off, then we have some ways of insulating it, but the best is to remove it if possible. We do want you to bring glasses if you wear them, or hearing aids, because you will need them right before and right after the operation. The day of your operation, our routine at UCSD is you first stop on the first floor of the hospital to admitting, where they take your insurance card and all your contact information and get you admitted to the hospital. You have to sign a bunch of forms. Then you go upstairs to what's called the pre-operative holding area, and then they'll get you into a gown, and there's a small waiting room with a bed that you can sit with your family members until you're ready for the operation. You can bring family members and an interpreter with you until the anesthesiologist is ready to take you back into the room. Now, even though you've gone to the anesthesiology clinic, you may see a different anesthesiologist on the day of your operation. The surgeon doesn't change, but the anesthesiologists often change. You will also be meeting nurses that will be in the room. 2 nurses usually. One is a circulating nurse who's in charge of all the medications and getting things settled, and also a nurse that assists with the operation and hands the surgeon the instruments. At a teaching hospital like UCSD, you may also meet a variety of residents and students that will be helping or observing during the operation. You can request to limit the amount of people, but as a teaching institution, we often have residents and students in and out of the room observing so they can learn what is involved in operations and for the future. The nurses in the preoperative area will put an intravenous in your arm. It's a little catheter needle that goes into your arm that will stay inside you during the operation and after. That is so we can give you medications and we don't have to keep putting new needles in. So it's one needle that stays in. Before your operation, the anesthesiologist will give you some medication that will make you less anxious. It is normal to be anxious before your operation. If you weren't anxious, we'd be worried. There is always some risk to every procedure you have, so it's normal to have a little anxiety about it. So they will give you some medications to relax you, also some antibiotics. They will ask you again about your allergies. So if you forgot to mention any, please let us know, so you don't have a reaction to the antibiotics. Then they will wheel you in the bed into the operating room. All the surgeons and the nurses and all the students will have to wear a mask over our face. That is to keep down the bacteria from us to getting to you. There are no exceptions to this, so you will not be able to read lips. So when you saw the anesthesiologist in the preoperative area and worked out some hand signals, how you're going to communicate, you may want to talk to the anesthesiologist again about what these signals involve. Basically, what we're going to ask you to do once you get into the room is to go from one stretcher to a bed. And you have to slide over on your back. Then they'll put an oxygen mask on your face and ask you to take some deep breaths. Then they'll put you to sleep. So we do this in patients who don't speak English, and we manage to communicate. It's just, we have to ask you to do a couple things. The other thing is we will put on some boots on your legs to prevent blood clots while you're asleep, because you won't be able to move. When you wake up, it'll be over. Initially, you may be very sleepy, hard to stay awake. The anesthesiologist may try to get you to do some commands to make sure that you're really awake enough to take out the breathing tube. They may hold your hand and ask you to squeeze their hand, or they may want you to open your mouth so they can take out the breathing tube. Once they get you over onto the stretcher again, they will wheel you into the recovery room. You may feel pretty shaky when you wake up, but that will pass. Please ask your interpreter to stay during the operation so they're available when you wake up. They will need you in the recovery room to let us know if you're in pain or you're nauseated. You're usually in recovery for several hours, and then they will get you settled and then transferred to a regular hospital bed. And that is what you can expect before and on the day of your operation. Thank you.